Okay. Um, Hello, my name is Lismeri Pujols Ortiz. Um, and today we will complete the pronunciation, translation, and exercise of chapters 25 to no 24 to 34. Okay, let's do this. The pronunciation. Um, okay. Chapter no, chapter no. Part 24 Infections. Fever. A medical student has made some language notes on a case report. Case 45. A 24-year-old man presented with a fever which he had had for 3 days. On the third day, he had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever. Infectious infection with Epstein-Barr virus at the age of 18 years. He had returned from Africa 3 weeks previously. Okay, fever. Fever occurs pyrexia, also remember PUO, pyrexia of unknown origin. Fever, also known as temperature. I have got a temperature. Adjective equals feverish, febrile, and pyrexia. And pyrexia opposite equals a febrile and a pyrexial. Some symptoms of fever: sweating, rigors, severe shivering, and sensation of coldness, also known as chills. Part B. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms such as viruses or bacteria that can usually be identified, thus establishing the etiology early in the illness. Many of many of potentially no Many of these organisms, including all bacteria, are sensitive to anti, anti, antibiotics, and most infections are potentially curable. Unlike many non-infectious um, degenera- degeneratives and chronic disease. Communicability is another factor which differentiates infections from non-infectious disease. Transmission of pathogenic organisms to other people directly or indirectly may lead to an outbreak or epidemic. Finally, many infections are preventable by hy- by hygienic measures. by vaccines, especially leaf attenuated vaccines such as rubella vaccine or by drug prophylaxis. For example, chloroquine to prevent malaria. Microorganisms include um, bacteria, viruses, fungi, protozoa, such as the parasite um, that causes malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germs or bugs. Um, Notice the common expression for acquiring an infectious disease. Okay. Could he have catch some disease from the dog? Could he have picked up some disease from the dog? I think I have catch the flu bug that's going around. Source and spread of infection. Infection may originate from the patient's endogenous, usually from skin, nasopharynx, or bowel, or from outside source, exogenous. Often another person who may be either suffering from an infection or carrying a pathogenic microorganism. Quarries are usually healthy and may harbor the organisms in the drew for include water. No. For example, diphtheria, bowel, salmonella, or blood hepatitis B or HIV. Non-human source of infection include water, cholera, milk, tuberculosis, food, botulisms, 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 yeah, animals, rabies, apiarians, no, um, rabies, birds, psychosis, and also the soil, legionnaires disease. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others. Okay. The exercise is in another video because it's more easy for me. Okay. And the traduction too. Mental illness, part 25. Okay. Part A, psychiatric disorder. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is that associated um, with old age. Senile dementia, disorders in which there is no obvious pathology or anatomical change in an organ, are termed functional. These are described below. Substance abuse. Abuse of a substance means using using it in a way that is harmful. The commonest forms of substance abuse are alcoholism and drug abuse. Affective disorder. Affected and mood are similar meaning. Oh, is here? Yeah, here. Affect and mood are similar in meaning and refer to the emotions for happiness or sadness. Affect tends to be used for temporary emotions and is expressed through manner of speaking, facial expression, or behavior. Mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression, the symptoms of which are poor appetite or significant hate loss, weight loss, sleep disturbance, for example, insomnia, inability to sleep, fatigue, loss of energy, psychomotor agitation, excessive movement and thought or psychomotor retardation, slowing of movement and thought, loss of interest in stimulating activities, decreased ability to think and concentrate, feeling that one is of no value to others, of that one has done something wrong, recurrent thoughts of death or suicide. 5. Or possibly 4 of the above symptoms occurring nearly every day for at least 2 weeks constitute a major depression. Neurotic and stress related disorders. An example of neurotic disorder is obsessive compulsive disorder. An obsession is an idea that is so persistent that it interferes with the patient's life. A compulsion A compulsion is an obsessive idea that forces the patient to act even though they recognize that is unnecessary. A common form of this is compulsive washing of the hands. Stress is a feeling of being unable to cope. It can lead to anxiety or fear of problems. A sudden attack of anxiety is called a panic attack. Other types of functional disorder. These include behavioral syndromes associated with physiological disturbance, such as eating disorders, disorders of adult personality and behavior, for example, personality disorder, mental retardation, delayed mental development, schizophrenia, and other disorders in which there are delusions, false belief. Okay, 25. The nervous systems. The nervous system. Part 1. Sensory loss. The central nervous system controls the sensory and motor functions of the body. Disease of this system therefore lead to loss of some of these functions. Okay, the table. This table. Function, loss and other symptoms. Hearing, deafness, buzzing or ringing in the ear, tinnitus, sight blindness, double vision, the diplopia, um, symptoms like blurring, loss of visual acuity, clarity of vision. Function, sensation, feeling, loss, numbness, anesthesia. Other symptoms, tingling or pins and needles, paresthesia, balance, unsteadiness, ataxia, dizziness, vertigo. Note: there are no common words for loss of or conditions relating to taste and smell. Motor loss. Motor loss symptoms and signs include weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythmic movement, especially of the hands, abnormal gait, unusual manner of walking. Speech may also be affected, for example, with hoarseness, a rough, deep voice as in vocal cord paralysis, slurred speech means poor articulation as in cerebellar disease. Loss of consciousness. Yeah. Patients may describe sudden loss of consciousness in a number of ways. I passed I passed out. I had a blackout. I fainted. I had a fit. I have a seizure. I had a convulsion. Fit. Fit, seizure, and convulsion are all used to refer to violent, involuntary movement, as in epilepsy. Doctors may say, when did you lose consciousness? Consciousness. Okay, this part now. The principal differential diagnosis is between an epileptic fit and a syncopal attack or fainting. Syncope is a sudden loss of consciousness due to temporary failure of the cerebral circulation. cerebral circulation. Syncope um, is distinguished from a seizure principally by the circumstance in which the event occurs. For example, syncope usually occurs whilst standing under situations of severe stress or in association with arrhythmia. Sometimes a convulsion and urinary incontinence, loss of control of the bladder, occur even in syncopal attack. Thus, neither of this is specific for an for an for an epileptic attack. The key is to establish the presence or absence for prodromal symptoms or symptoms that occur immediately before the attack. Syncopal episodes are usually preceded by symptoms of dizziness and lightheadedness. In epilepsy, people may get a warning known as an aura that an attack is going to happen. Note: the noun convulsion is often used in plural form. He had convulsions as a child. Okay, this part. The nervous system, or yes, part 2. The motor system. Examination of the motor system should include assessment of the following: muscle bulk, amount of muscle tissue. Look for signs of wasting muscle atrophy. Muscle tone, amount of tension in a muscle when it is relates, relaxed. Relaxed. Tone can be increased spasticity or decreased flaccidity. Muscle power, strength, coordination, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking, reflexes. See V below. Involuntary movement, for example, a tic or a tremor. Case 80. On examination, her face showed little or no expression. There was a tremor affecting mainly her right hand. She had generally increased muscle tone. Power, reflexes, coordination, and sensation were within normal limits. Examination of her gait that showed that she was slow to start walking and had difficulty stopping and turning. Tendon reflexes. Examination of the nervous system normally includes testing the tendon reflexes, for example, the knee jerks with a tendon hammer, also known as a reflex hammer. The reflexes may be absent, zero, dis, diminished, normal, or breast. The plantar reflex are also checked. The normal, no, yeah, the normal plantar response is a downgoing movement of the big toe and upgoing toe extensor or Babinski response is abnormal. Okay, testing the knee jerk with a tendon hammer. Okay, coma. Coma is unconsciousness unconsciousness with a reduced response to external stimuli. Doctors say the patient is in a coma. The patient is a comatose. The Glasgow Coma Scale (GZS) score is calculated as follows. Okay. Um, eye opening, verbal response, motor response. Okay. Spon- spontaneous to speech to pain, none. Orientate, confused, inappropriate, incomprehensible, none. Obeys, localizes, withdraws, flexion, extension, none. Oncology, part 28. Oncology. Neoplasms. A neoplasm is an abnormal new growth of tissue. Malignant neoplasms, cancers, cancers are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. You have a small growth in the bowel. You have a small tumor in the bowel. A lump or a swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to a neoplasm, but there are other causes such as inflammation or fluid accumulation. Patients say, I have a lump in my left breast. Doctors say there was a firm, palpable mass in the liver. Mm, Malignant tumors are characterized by rapid growth and invasiveness. The tumor may invade local tissues or may spread to distant parts of the body. Metastases, neoplasms, which are the result of metastases, are called secondaries as opposed to the original. We have the results of the scan back now, and I'm afraid they show that she'll have a small growth in the prostate. Fortunately, it appears to be at an early stage and there is no sign of a spread. So, if we remove it, there is every chance of a complete a cure. A cure. Note: to invade verb is to enter and spread draw out a part of the body, and this process is invasion. Now, if a tumor is described as invasive, it has the ability to spread. Symptoms and signs of malignancy. Malignancy. The symptoms are malignant. Disease may be related to the size and location of the tumor. For example, a space occupy, occupying occupying lesion in the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct, block the lumen, and cause changing bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 55. A 33-year-old man presented to his GP complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kilograms in weight. He was also complaining of night sweats. He had no significant past medical history. Treatment of tumors. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. See Unit 4542. When a cure when a cure when a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. Okay. Pregnancy and childbirth. 29. Childbirth. The expected date of delivery, EDD, is the date on which a woman is expected to give birth to the child she is carrying, pregnant with. It is calculated by adding 280 days or 40 weeks to the first day of the last menstrual period. Childbirth is also referred to by doctors as parturition. Delivery is a process. Delivery is a process of helping the child to be born. A spontaneous, a spontaneous vaginal delivery (SVD) is abnormal delivery. If there are complications, the baby may be delivered by cesarean section, surgical removal. A full-term pregnancy is 40 weeks divided into 3 trimesters. A baby who is born before this is premature, and one born after 40 weeks is postmature. A baby who is born dead, for example, because the umbilical cord is around its neck is stillborn. A pregnancy may end before term spontaneously with a miscarriage, spontaneous, spontaneous abortion, or be deliberately terminate with an induced abortion, termination of pregnancy. Note, the verb induce means to cause something to happen. Labor, the process by which the fetus and placenta are pushed out of the uterus, is called labor. It is divided into four stages. Some words which are combined with labor are premature, prolonged, spontaneous, induced, induced, false labor. Presentation and lie. Fetal lie is the position of the fetus in the uterus. In the uterus, the normal lie is longitudinal, and the abnormal lie is transverse. Fetal presentation refers to the part of the fetus which occu- occupies occupies the center of the pelvic canal and which the examining finger feels on vaginal examination. Butterworth. The normal presentation is with the head. Vertex presentation. Bridge presentation means the buttocks are presenting. Bridge is an old word for buttocks. Abnormal presentations may require delivery with forceps. Forceps. Okay, this part in another video. Thank you for watch.